Hello and welcome to this week's What Were They Thinking? This week's news items relate initially to COVID-19 and the increased risk of diabetes 2 as a result of infection. Interesting news on court decisions regarding the Gardasil vaccines and a case against Merck. New and possibly groundbreaking contraceptives that will be used by males rather than females. A somewhat questionable study that links artificial sweeteners to a variety of other issues, such as cancer. There's also an interesting case study for those who enjoy their time in water. The timestamps for these and other news items can be found in the description box below. Let's start with the link between infection with COVID-19 and diabetes type 2. Type 2 diabetes occurs when the body has resistance to insulin and no longer responds to it the way it should. This means cells across the body are unable to increase their glucose uptake, leading to hyperglycemia or excess sugar in some cases, and in other cases a variety of issues from not being able to utilize glucose properly. This means individuals with type 2 diabetes tend to have insulin given to them. For most countries, this is a well understood and well recognized problem, and so insulin is subsidized. In other countries, such as America, the cost of insulin is almost prohibitive to be able to treat oneself for these issues, and so if there's an increase in type 2 diabetes from COVID-19, this may be an issue across the globe, but more so in some countries than others. The complications arising from type 2 diabetes will then generate a whole series of sequelae pathologies that will be all kinds of problems: eye diseases, foot problems, heart diseases, kidney problems, nerve problems, and so on. This is a very big problem, and if you increase the frequency with which it occurs simply by the prevalence and vast infection rates of COVID-19, you're going to have a problem. The findings of the study are summarized in two key points. There's a 28% increased risk of type 2 diabetes for those who were infected, although this is a 28% increase in relative risk, not raw risk. The incidence of other types of diabetes did not differ, so this is your type 1 diabetes, and so it is only type 2 diabetes or insulin resistance or insufficient insulin production that occurs as a result. This is why something like vaccines for COVID-19 are so very important. They will head off long-term and unanticipated complications of infection by minimizing the duration and severity of infection. This is admittedly the same idea behind just about all vaccines. They either exist to stop the disease from occurring in the first place, or to minimize the severity and duration. The lawsuit against Merck demonstrates the fundamental misunderstandings by many people about what vaccines do. In this case, the suit was brought against Merck, the manufacturer and developer of Gardasil in some cases, claiming that it causes harm. As we previously pointed out, the vaccine does the exact opposite of harm. The prevalence of Gardasil vaccine and its wide uptake has caused a greater than 90% reduction in the number of cervical cancer cases. The case itself was based on a tort claim. The woman claimed that the Gardasil vaccine caused her harm, including postural orthostatic tachycardia syndrome and chronic fatigue syndrome. This is the sort of claim that there are various laws in place that are designed to stop from going forwards, and in this case, the federal law preempted the tort's claim because the Food, Drugs and Cosmetics Act said that these particular areas of harm were not covered by its torts law. The claim was too vague and too broad. This does mean that when they dismissed this suit, they did so without prejudice. This means the claim can be brought back if the representation for the individual can correct the problems the court has identified in the case. Because the basis of the suit was never established, that is, that the torts element was valid, the case never actually argued whether or not the vaccines caused harm. As a result, when they bring it back, and if it somehow gets to the next stage of the proceedings, they can argue that the vaccine caused harm. While on the topic of medical developments, we'll look at another brain implant. In this case, a brain implant, which allows an individual with locked-in syndrome to be able to communicate again. Locked-in syndrome is where someone effectively has no way to control their body. Their mind functions, and they can think, feel, and so on, but they have no way to then interact with the outside world. This is a big problem, and it is perhaps some people's worst nightmare. In order to be able to solve this issue, researchers have been looking at ways to circumvent the big problem. That is, how can you make it so the brain can directly interact with the world? And this is where an implantable chipset allows the individual who was experiencing locked-in syndrome to be able to begin communicating again. This is not an experiment that was set up out of random chance. Rather, as the patient's condition deteriorated, one of the last things they agreed to before they lost any ability to interact with the world willingly was to take part in this experiment. It involves 2 microchips planted in the brain in the parts of it responsible for muscle activity. Each of these has a number of small points coming off of it, and these needle-like electrodes implant into the brain and detect the electrical activity going on. These get converted into what is almost a binary setup of either a yes or no signal. That signal and the system overall has about an 80% accuracy rating, and considering that they have no capacity whatsoever to interact with the outside world in any way without this, that is a huge step up for them. But that could also be something to do with the system itself. It does have its flaws, notably that it relies heavily on the letters for the spoken words or sentences that are trying to type out to be selected for from audible cues. Each letter is spoken aloud, and if it's the right letter, it's selected for. If not, it's not selected. And from this, it is possible that the slow typing speed of about 1 letter per minute and the fact that it has 80% accuracy means that there's a lot of room for improvement. After about 460 days, the patient who volunteered for this is able to produce sentences that are between 4 and 5 words in length. Most words are only a few letters long, and the longest appears to be about 7 letters in length. This means that the capacity is limited, but as stated, by contrast to being locked inside your own body, unable to interact with the world in any way, shape or form, this takes away much of the isolation that they were experiencing. Going from cutting-edge treatment for something that is put in practice to cutting-edge treatment that could be put in practice, an oral contraceptive for males that was 99% effective, albeit in a rodent model. And this is a big caveat. Rodent models do not always translate successfully to humans. For example, research that showed the physical block for the testes of males also showed that it wasn't reversible in all cases, and therefore the reversible attempt to create a contraceptive wasn't reversible in all cases. In others, male oral contraceptives have led to sterilization. That is why, although this is promising, it's also not necessarily going to go forward any further than it already has. Assuming that it does proceed forwards and is effective, it would be a significantly big step forward in contraception. For the last 60 or so years, the only contraceptives that have been available as an oral medication was the contraceptive birth pill for women. Males could use things like condoms, or there could be contraceptive gels and similar. The pill was, however, for the most part, the most effective option as it gave women control over their bodies. To an extent, this would take away the onus from women to some extent and put it on men to be as responsible. One of the biggest challenges with these medications is that, as far as the female contraceptive goes, it would never have been approved under current standards for it. This is why getting a male contraceptive is so very difficult. In order to be able to do so, many hurdles must be passed. Hurdles that, as said, if you were trying to create something on par with the female contraceptive, would be too high and unachievable. This has made it very hard to create a hormonal-based product for men. This, however, is not based on hormones. Rather, it works by trying to target something else as a different mechanism. It looks to target the retinoic acid receptor. This is involved in using vitamin A for sperm formation. By targeting that, you can prevent the production of sperm, and thereby try and avoid the need for a contraceptive by not allowing any sperm to develop in the first instance. Whereas if you were to target this hormonally, the reduction in testosterone would have significant impact in other parts of the body beyond just the testes. This contraceptive is about on par with the female contraceptive and condoms at 99% effectiveness. So it's not a cure-all, but it is one of several tools that would prevent unintended pregnancies from occurring. Once reproduction is desired, it takes between 4 and 6 weeks to resume normal reproductive functions in the male mice. In other health-related news deviating from biological health to instead dietary health, a large-scale study was published this week, which made the rather bold but somewhat evidenced claim that synthetic or artificial sweeteners could increase the risk of cancer. Understand that this is a very bold claim, and the evidence that they've used to substantiate it isn't as solid as some might like to claim. Artificial sweeteners, like aspartame for instance, are used in dietary products. This removes the need for sugar like sucrose or high fructose corn syrup. These have their own risks associated with them, but they are also calorie rich. As a result, using these artificial sweeteners removes the calorie content but retains the sweetness. This then has carry-on effects for health by reducing things like obesity and other diet-related side effects that are undesirable. That gives the upside to artificial sweeteners. Now for the downsides, or at least downsides as far as this study goes. It's based on about 100,000 people in France who were self-reporting their diet, lifestyle, and medical history between 2009 and 2021. This was then compared to rates of cancer and other variables. This is a very important thing to note. It is a self-reported study. So this is the first big note we need to take. Self-reporting studies are always prone to errors. Many people will either not want to report adverse behaviors, or they will fudge numbers to make them more agreeable to what they think is meant to be given. The researchers found that those who reported a higher intake of artificial sweeteners had about a 13% increase in risk compared to those who did not consume it. That's a very big change. There's also another flaw to this study. 79% of the respondents were female, and 37% of all respondents consumed artificial sweeteners. More than half of this intake was in the form of soft drink. This means that you have a big difference in who's consuming what, and so trying to isolate one factor, in this case artificial sweeteners, in the context of a much wider multifactorial study like this isn't necessarily going to happen. There is good reason to suspect that lifestyle above and beyond consumption of artificial sweeteners in soft drink could contribute to the same risks, and this may be something of a red herring. Consider those who are consuming artificial sweeteners in soft drink are likely being mindful of their weight and trying to avoid gaining weight or are trying to lose weight. Others instead are using it in lieu of something like normal sugar because they have conditions like diabetes. There are a wide range of possible factors beyond this that haven't necessarily been caught in the study as it was designed, and so this is not proof. It's simply a continuing line of evidence that artificial sweeteners and actual sweeteners may play a role in socioeconomic, behavioral, risk factors, and sociological elements that all contribute to an increased risk of things like cancer, among many other health problems. Artificial sweeteners may be a sign of a wider issue, and instead not the causative effect. Going from health news that is the development and continued study of things that we know exist, to an unusual case study of something that you may not see again. It's the investigation of why a man in his 20s developed excessive wrinkling, white bumps and patches of thick skin on his hands whenever they were put in water. It turns out that he had a rare disease that is called aquagenic syringeal acrokeratoderma, a condition that's rarely seen in males and nearly always seen in young women. It's also commonly associated with cystic fibrosis. The diagnosis was only given after an extended period during lockdowns with COVID-19. Prior to that, doctors had given him a diagnosis of eczema. This had then been treated according to best practice using steroidal creams. In the last 18 months, the condition appears to have continued to spread up his arm reaching his elbow. In the most recent time, before he went to the hospital, it had become worse after having to frequently wash his hands due to COVID. Every time he would wash his hands, the symptoms would disappear after about half an hour, and that was the telltale symptom that made clear that this was not eczema. Going back to research into methods to help treatment, but this time looking at a treatment that would help to allow things to pass through the blood-brain barrier that much better. The blood-brain barrier is incredibly important. It keeps out pathogens from the most important organ in your body's ability to function. It also ensures that nutrients and other things can get through when and how they need to. This feature also provides a big problem when it comes to medication. Most medication struggles to pass through the blood-brain barrier, that is, unless you have a very high dose. In order to be able to treat brain-specific problems, you need to have a lot of medication, and this medication, because of the high dosing, often carries with it a wide number of side effects. This is one reason why antidepressants are ramped up very slowly to ensure not only can the body cope with the new medication, but the side effects can also be managed from the amount of medication getting into the brain. If there is a way to make it so that drugs can more easily pass through the blood-brain barrier, you can hopefully be able to give a smaller dose but with greater effectiveness. This is where a new antibody is hopefully going to achieve some of those results. The antibody is designed to be a temporary key to open up the blood-brain barrier for a few hours at a time. This allows for medication to be administered, have its effect, the blood-brain barrier close up again, and the body go back to normal functioning with minimal risk. The way this works, in the simplest of terms, is that the joining of a ligand with the proteins involved in the blood-brain barrier is what makes it solid and relatively impermeable. By interfering with one of these, notably the ligand, you can open up the blood-brain barrier and allow things to pass through. The final news item for this week is all about RNA and how the development of a particular RNA molecule could help us to replicate the earliest stages of the development of life on Earth. We've previously described the physics theory that if you have RNA initially, then DNA and more complex molecules over time, you would be able to create life from very limited material initially. In order to be able to get that, in order for the very first step to occur, RNA has to be able to self-replicate. And this is one of the biggest challenges to the study of evolution in the earliest stages of life on Earth. How could you get an RNA molecule that could self-replicate? Once you have this self-replicating molecule, you then need to look at how it could evolve and develop the complexity that we see in RNA today. And that's where a study from Japan and the University of Tokyo gives us some idea as to what could be happening. Because RNA is single-stranded, you have the ability to replicate it more easily than you can with DNA, that is, two strands of nucleotides side by side. RNA being a single strand means that it just has to find the right nucleotides to match as to what's already there, and it can begin creating another copy by creating a model in which RNA could replicate and diversify. Researchers were able to see what would happen with more and more competitive RNA species. By putting up to 5 in one small environment, they were able to show that they could live mutually and coexist. This means that even if you have RNA with different needs and wants, but all building on the same basic resources, they could diversify and keep going. This means that there is a way to model how RNA could not only survive, but mutate and evolve into new, more complex molecules. This is, however, a far cry from the complexity of life at even the most basic level today, let alone something as complex as, say, the human body. This is just one very small stepping stone that indicates that there is a viable pathway from the Big Bang to where we are now in evolutionary terms. That's all the news we have for you this week. Thank you for watching. If you have found this interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions that you have below.